Hi, my name is Andrew Nevins. I'm with the Division of Infectious Diseases at Stanford University School of Medicine. In this video, I'll be talking about manifestations of chronic Epstein-Barr virus infection. The learning objectives for this video are to describe the clinical presentation of reactivated EBV infections and to relate the clinical manifestations of EBV infection to viral pathogenesis and the role of the immune system. In the previous video, we talked about how reactivated EBV infected cells can transform into a number of different types of malignancies. These include Burkitt lymphoma, some types of nasopharyngeal carcinoma and Hodgkin's lymphoma, central nervous system lymphoma, the so-called post-transplant lymphoproliferative disease, and oral hairy leukoplakia. B cells in EBV-associated malignancies do not express lytic genes, but rather certain patterns of latent genes, the specifics of which have not entirely been determined. Gene expression is actually different in different cancers. Burkitt lymphoma is a B-cell tumor that characteristically involves the jaw or other facial bones, distal ileum, cecum, ovaries, kidneys, or the breast. The endemic variant, also called the African variant, most commonly occurs in children living in malaria-endemic regions of the world, such as equatorial Africa. It is believed that chronic malaria reduces resistance to EBV, allowing it to take hold. EBV infection of these tumor cells is found in nearly all patients, and the virus is therefore thought to be directly implicated in the development of this tumor. On a genetic level, it is a monoclonal cell tumor typically containing an 814 or 822 chromosome translocation that leads to dysregulation of the endogenous c-Myc oncogene. In addition to this endemic African type of Burkitt lymphoma, a sporadic type of Burkitt lymphoma, also known as non-African, is the most common variant found in places where malaria is not endemic. Although a similar B-cell tumor type, this lymphoma variant is actually only rarely associated with the Epstein-Barr virus. The jaw is less commonly evolved compared with the endemic variant. The jaw is less commonly involved compared to the endemic variant. The ileocecal region is a common site of involvement. Non-Hodgkin's lymphoma, which includes Burkitt's, accounts for 30 to 50% of all childhood lymphomas. Histologically, the Burkitt lymphoma tumor consists of sheets of a monotonous population of medium-sized lymphoid cells with high proliferative and apoptotic activity. The so-called starry sky appearance is due to the Burkitt cells containing numerous intracytoplasmic lipid droplets. As some cancer cells die, their lipid is phagocytosed by benign macrophages, which become the stars. Another EBV-associated tumor type is nasopharyngeal carcinoma. Nasopharyngeal carcinoma is endemic in persons from southern China and in some certain native North Americans. EBV viral genomes are present in tissues from all patients with non-keratinizing nasopharyngeal carcinoma. Tissues from patients with the disease show expression of many different latent gene products, including EBNA1 and occasionally LMP1 in 40 to 70% of cases. Patients with Hodgkin's disease often have elevated levels of antibodies to EBV antigens before or at the time of presentation of lymphoma. This condition was long presumed to reflect evolving impairment in cellular immunity. Recently, however, tissues from upwards of 20 to 40% of patients with some of the more aggressive subtypes of Hodgkin's disease were found to contain EBV genomes with expression of some latent gene products but not others. Therefore, although we do not yet know the final answer, EBV may play a role in the pathogenesis of this very common type of lymphoma. Central nervous system lymphoma typically occurs in patients with advanced T-cell immunosuppression, particularly in those with advanced HIV disease. A focal lymphomatous lesion presents most typically in the brain, but in some instances can occur in the meninges, eye, or spinal cord. Patients usually present with a headache, focal neurological symptoms, and, at times, neuropsychiatric symptoms. In some cases, seizures may occur as well. Imaging typically reveals one or more homogeneously enhancing lesions in the periventricular white matter. Imaging appearance closely mimics Toxoplasma gondii in this patient population as well. Cerebrospinal fluid analysis typically shows an elevated intracranial pressure, elevated protein, a lymphocyte-predominant pleocytosis, and the presence of malignant lymphoid cells on cytological examination in up to 40% of patients. Histologically, this type of lymphoma contains large neoplastic lymphoid cells with pale chromatin, prominent nucleoli, and scant basophilic cytoplasm. Mitoses are typically not hard to find. These lymphoma cells are typically located in a perivascular distribution and are larger than typical lymphocytes by about 3 or 4-fold. Many, but not all, B-cell lymphomas in patients with AIDS contain EBV genomes. Unlike the tumors seen in congenitally or iatrogenically immunosuppressed patients, these lymphomas contain chromosomal translocations and subsequent oncogene expression similar to those seen in Burkitt lymphoma. Although the exact cellular and molecular events leading to neoplastic transformation remain to be clarified, most of these tumors in patients with AIDS also express the full repertoire of latent genes. An emerging form of EBV-associated tumors is post-transplant lymphoproliferative disease, or PTLD. In this syndrome, EBV-infected B cells give rise to immortalized and transformed tumor-like cells in the face of chronic immunosuppression. This disease is most commonly encountered in transplant patients receiving chronic immunosuppression to retain their transplanted organ, but it can also be seen in congenitally immunosuppressed infants and children. In transplant patients, immunosuppressive medications used to prevent organ rejection may prevent control of B-cell proliferation, resulting in subsequent unrestrained growth. Patients with PTLD typically present with nonspecific symptoms. Patients with PTLD typically present with nonspecific symptoms, including persistent fever, night sweats, and weight loss. Specific symptoms may vary depending on the exact location of the tumor, which can occur in many different parts of the body. Treatment usually consists of reduction of immunosuppression. Surgical resection of localized tumors may be beneficial in certain cases. Aggressive tumors may require chemotherapy or radiation therapy, or both. Lastly, oral hairy leukoplakia is an EBV-mediated mucocutaneous lesion most commonly observed in patients infected with HIV. Although well described, it is an uncommon disease involving the lingual epithelium. OHL is not considered a premalignant condition, being unlikely to progress to squamous cell carcinoma. OHL lesions appear to be relatively specific for HIV infection since they are only rarely observed in patients with other immunodeficiencies. Another similar appearing, yet much more common condition seen in this patient population is oral thrush, which is overgrowth of the yeast Candida as a result of either immunosuppression or systemic antibacterial use. OHL lesions are described as firm, white, corrugated, painless plaques that, unlike the smooth, soft colonies of Candida, cannot be scraped off from the surface to which they adhere. OHL generally affects the lateral portions of the tongue, although the floor of the mouth and the palate may also be involved. Thrush, on the other hand, usually affects the buccal mucosa. Neither of these lesions are typically associated with fever. Interestingly, OHL is the only EBV-associated lesion that appears to arise as a direct consequence of replication of the linear genome of EBV rather than dysregulation of cell growth from latent gene overexpression. Therefore, it usually is amenable to antiviral therapy. Treatment with antiviral medications or topical therapies have been used, although the use of highly active antiretroviral therapy to treat underlying HIV infection can also be effective and has significantly reduced the incidence of OHL. This video has focused on the conditions associated with chronic Epstein-Barr virus infection. As summarized in this table, each of the 8 human herpes viruses can be associated with both acute and reactivated disease manifestations.